Unhealthy Healthcare Providers by Alexandria Savage. Overview. So I have the introduction, the practice problem, the Peacock question, the inclusion, the exclusion, the evidence, change process, database evaluation, dissemination, conclusion, /summary, and my references. So my name is Alexandria Savage. I graduated from the University of Tennessee at Chattanooga. I received my Bachelor's of Science in Exercise Science. I'm pursuing my Master's of Science in Health Administration. I'm not currently working in the healthcare field, so this definitely was more of a challenge than if I would be working in the healthcare field this class was. My practice problem. Physicians and other healthcare providers have a tendency to pay less attention to their own personal health while providing healthcare to others. Lack of adequate healthcare offered to themselves. That's one of the big reasons why they don't pay attention to their own health. Following proper infection control and hand hygiene lessons over time. They get more and more in a hurry. They just use a little bit of hand sanitizer, or they don't actually wash their hands, and over time, that even lessens more. My question was, how unhealthy are healthcare providers? My inclusion. I use doctors and physicians, other healthcare professionals, healthcare provided to those working in the field, hand washing / hand hygiene, infection control, alcohol-based hand rubs, my primary research and secondary research, which was review and analysis. Exclusions. Articles pertaining to healthcare received by patients and others, anyone not working in the healthcare field. If it was a patient, I didn't use it. Articles that did not provide a full text. There's a lot of scholarly journals or scholarly evidence out there, but there's not a full paper on that. Articles that did not pertain to healthcare-oriented health and safety. My evidence. Use of alcohol-based hand rubs increases frequently at which hand hygiene is performed. Infectious diseases and pathogens are reduced through the proper infection control. EMT personnel have provided evidence of failing to follow proper hand hygiene in between each patient seen. Physicians do not put their health before the patient's, thus leading to their health worsening. My change process. The model chosen for the change process is the Stettler model of planned change. The model has 6 steps. These steps include relationship, diagnosis, acquisition of resources, selecting a path, establishing and accepting of change, maintaining, and separation. In the relationship step, it is imperative to establish a relationship with healthcare providers and establish their trust before implementing any type of changes. The diagnosis step is where the changes that need to be made are determined, and the target group decides changes are needed. In the acquisition of resources step, resources that are needed for the change to be made are gathered. This is where teams are made and auditors are collected to assist in the data collection and implementation of change. Hand rubs will be researched to determine the best choice to be implemented in facilities. Materials will be created and gathered to assist in educating the healthcare providers. Additionally, a staff member for each facility will be selected and trained in maintaining the changes after completion. Selecting a path is when a solution is determined and steps forward the goal are taken. The best method of improving healthcare providers' personal health will be determined and the selected changes will be implemented. Establishing and accepting the change happens when the change has taken place and the target group accepted the change as a daily routine. The best way to achieve acceptance is to implement the change gradually into a daily routine. This will allow the staff to accept the change a pace that will prevent them from rejecting the ideas. The final step is the maintenance and separation. Maintenance will consist of maintaining the changes over time. After it can be assured that the changes will be maintained by the staff of healthcare providers, the team implementing the changes can separate from this facility and allow them to oversee the maintenance for themselves. And then I also have a changes process continued. Data-based evaluation. Surveys and questionnaires, facility auditors and team members, evaluation panel, continuing evaluation of changes. Physicians and healthcare staff will be asked to participate in studies and fill out questionnaires during all stages of the change. Data will be collected prior to the implementation of the changes during the implementation, and after the implementation has been effectively established. The data will be collected and placed together on charts displaying the progress of the change and outcome of healthcare providers reporting healthier personal results. The data collected through surveys and questionnaires will be tested with Cronbach's alpha. The test determines the reliability of the items on the scale and their consistencies to each other. Facility auditors and team members can evaluate the facilities where the change is being implemented and record the progression data. They will document the frequency at which healthcare providers in all aspects of the facility perform infection control protocols, and with that material and what materials they use. Additionally, they will record the health status of the staff at any given time during the process. Finally, an evaluation panel will be made to provide insight on the data that has been collected and verify their legitimacies. The panel will consist of physicians in varying fields of healthcare who can provide accurate and professional opinions on the resulting data and outcomes. A panel would be selected because of the overall lack of previous research on the topic. Providing difficulty in comparisons to other findings, over time, evaluations will be made periodically in the facilities to determine if the changes are remaining in place. These evaluations will consist of collecting data such as frequency of infection control protocol, amount of staff reporting being ill and missing work, as well as materials being provided at hand washing stations or for personnel use of staff. Dissemination. I have local hospitals, physician's office, regional conference halls, national and international online conference. The results will be shared on the level that the significance justifies. If the results only justify being shared on a local level, meetings will be held at the hospital or physician site where changes have been implemented. Staff will be required to attend the meetings that are being held. More than one meeting can be held at each location to ensure that all required staff can be in attendance and receive the information. If the results justify sharing at a regional level, then a location will be selected centrally in the area. The location will be at a conference hall that many people can be in attendance. Not all staff will be required from hospitals and physicians' office. Only the pre-selected staff, physicians, and policymakers will be required to attend the conference and report back to their respective places of employment. If the results require sharing them at a national level, there will be an online conference held for policymakers and prominent physicians of selected institutions. The conference will be held at a time that all could participate from anywhere. Conclusion. Further research cannot be determined if this is the best change to improve health. Hand rubs should be provided to healthcare providers. Infection control needs to be maintained at appropriate levels. Though all the research that I have done, I have come to the realization that there is need for further research in this topic. There is lack of research to compare findings and establish a good baseline of effectiveness of this change as to other changes. It would be greatly beneficial to compare the selective change to other changes to determine if the finding were significant enough to apply to a large scale. The results can be determined, the effectiveness of the change, and what level of changes need to be implemented. Staff should be given an effective hand rub with high enough grade disinfectant to improve overall health and prevention of pathogens from transferring. Infection control must be maintained by all healthcare personnel. Frequency needs to be increased as well as in between interactions with patients. And then this is my reference page. And then if you have any questions, just feel free to ask. Thank you so much, and thanks for listening.